people. How is everybody doing? I believe we are all fine. I welcome you back to my YouTube channel. This is JEMIENAFTALY, and the channel's name is called the Pediatric World. This is all about the kids' welfare, the medical problems, and also we try to find the solutions here. So here we talk to everyone. We talk to the mothers, we talk to the caregivers, the guardians, and everybody on the common illnesses that children get while growing up. And here we try to be as layman. We want to be simple so that these mothers, everybody is able to understand. So I welcome you to my YouTube channel. If you're new, please join the family and also remember to subscribe. So today's episode is on what we had last time. We are continuing on the causes of diarrhea and vomiting in children. So the causative microorganism, the commonest is the rotavirus. We mentioned it somewhere. And other viruses that are involved here, we have things like enteric adenoviruses. We also have astroviruses, just to mention a few. So we are saying the commonest is the rotavirus. And this is why we said that the rota vaccine was added by the EPI. Remember the expanded program of immunization. It was added due to the many cases of diarrhea and the severities of diarrhea. So nowadays we have the vaccination against this rotavirus that is causing these diarrheas in children. We have other bacteria. We have also bacterio-causative microorganisms. And just to mention a few, we have things like Shigella, we have Salmonellas, and also we have E. coli. So those are some of the bacteria also that cause diarrhea in children. How about parasitic ones? The parasitic causative microorganisms of diarrhea. For example, we have E. histolytica, the Entamoeba histolytica. This is a parasite that causes amoebiasis. We also have another one called Giardia lamblia. So babies, these are worms, and children are going to present with diarrhea when they have these worms. So these are some of the parasites that cause diarrhea in children. That is why we insist on routine deworming of these babies. And the first deworming should be started whenever the child reaches 1 year. So you should deworm your babies, and from there it should continue every 3 months so that we avoid these worms that cause diarrhea. Other causes of diarrhea we call them drug-induced, e.g. the antibiotics associated. We say they are antibiotics or they are drugs, e.g. the antacids, that will cause, yes, you take them and they are going to help. The children take them and they are going to get helped. But in the end, the side effects are diarrhea. They get diarrhea after taking these drugs. This is what we are calling drug-induced or antibiotics-associated diarrheas. We have food allergies or intolerances, e.g. in cow's milk, protein allergies. So we are going to say that the cow's milk is associated with a lot of allergies, and this will eventually cause diarrhea. Maybe in a separate episode, we are going to see the composition of the cow's milk compared to the breast milk. Yeah, so we are saying these allergies, the cow's milk is going to cause diarrhea. We have things like disorders of the digestive system. And the disorder can be also in the absorption, the food absorption. And the most common one here is the malabsorption. When there's malabsorption, the babies present again with diarrhea. So disorders of the digestive system. We have things like chemo or radio, the chemotherapy or radiotherapy. These are the management. These are the drugs used in treatment of cancers in children. And we are saying they cause, the side effects, major ones are diarrhea. So when doing chemotherapy, if the babies are being treated for cancers, they need this chemo and radio. But again, we are saying these cause diarrhea in children. We have surgical causes. Surgical causes are things like the acute appendicitis. You know, an organ called the appendix whereby the food is collected, and when this appendix is inflamed, we call it acute appendicitis. And we are saying babies are going to present with things like nausea and also vomiting and also diarrhea. We have vitamin deficiencies. When there is vitamin deficiencies, for example, the folic acid deficiency, also the the vitamin 1 deficiency, these babies are going again to present with diarrheas. Other things are reduced intake of fluid and also the food. So if the baby is not getting enough food and fluid, and in exchange there is increased fluid output, so there is less intake, yet there is increased fluid output, like there is frequent urination, yet the intake is low. So we need, what we are saying here, we need to balance. For the body fluid should be in balance, so both intake and output should balance. We also have things like increased insensible water loss. These are things that we have got no control over. So these are things like tearing. We also sweating here. While sweating, there is some fluid that is lost. We have no control over this. But anyway, the fluid is lost and the babies get these diarrheas. What are the considerations in sources and also in the causes of diarrhea? What are the considerations? When the babies are brought to us in hospital, what should you consider when this baby is brought in with diarrhea? The professional caregivers here. So in hospital, when the mom brings these babies, number one, we need to know the stool characteristic. And the stool characteristic, number one, we need to know the color of this stool. Is it watery, like we said, or is it bloody? Does it contain blood? And here the management is going to be very, very different. We also, in stool characteristic, we need to know the volume. Is it large volumes of stool or small volumes? What is the frequency? How many times does this is the diarrhea episodes? Are they 2 times? Remember, for it to be diarrhea, we say it has to be loose stool and it has to be at least 3 times per day. So we need to know how many times this baby passed this loose stool. It is very, very important so that it may guide us in management, in treatment. We also need to consider the presence of associated enteric symptoms. The presence of associated enteric symptoms. Other symptoms are, if the babies have diarrhea, what do they have? Other symptoms like high fevers, the hotness of the body, yeah? Do they have abdominal pains? Do they have nausea and vomiting? Those are the associated factors with diarrhea. We need to know if there is presence of any of these or it's just diarrhea on itself. We also need to consider the food ingestion history. How long was the baby exclusively breastfed? Again, it repeats itself. We are saying all babies should be exclusive breastfed for 6 months without giving anything. Was there early introduction of weaning? Was there early weaning? Early introduction of food before the 6 months, because this will cause, we said it's another cause of diarrhea. So we need to know this food ingestion history. About the feeding bottles, we said they are risk factors to getting diarrheas. I will still insist on this. So you need, we talk to mothers, we need to advise them on use of those feeding bottles. Other things, we have history of water exposure. What source of water do these babies get? Is it boiled? Because we said contaminated food and water will cause again this diarrhea. And remember, this is where we talked of also the hygiene, the hand washing before handling any food for these children. Is there another consideration? We need to know if there is a travel history because of change of many things, even the weather. We need to know the predisposing conditions. We need to know the history of hospitalization, if any, because in hospitals also diarrhea is, they get this diarrhea again from the hospital. The nosocomials, remember, the hospital-acquired infections, and diarrhea is one of them. Any history of immunocompromisation? Is this, do these children have, is their immunity compromised? So are they HIV infected, or do they have cancers? It is important to know, because we said in immunocompromised children, we are going to have the severity of diarrhea is high, and it is very, very high compared to just a normal baby whose immunity is good. It's not compromised. So we need to know this history. We need to know about the malnutrition. These are still consideration. You need to weigh these babies to ensure that their weight goes hand in hand with their age, so that we don't have malnutrition. Because we said again, malnutrition, it's a severe cause. It is one risk factor. They have severe diarrheas. So thank you so much for listening to me. We are going to go bit by bit. And now we finish on the causes of diarrhea and vomiting in children. So thank you so much for listening to me. Again, if you haven't subscribed, please hit on the subscription button. Subscribe, keep subscribing. Like, share these videos widely so that most people can reach them, and we know people are going to get some help here. And if you have any question, drop a comment on the comment section. And also there's an email at the end of the episode. Please ask any question. Just email me on anything you need to know, any clarification. Please feel welcome. And also, if you're new, please join the family, and again, remember to subscribe. Hit on the notification bell so that you're able to know every time I post a new video. Thank you so much. Till next time, bye bye.